So Adam, talk to us a little bit about your background and kind of why you got passionate about this particular space and project.
Thank you, Chris, for inviting me here today and having a discussion with you. Actually, my passion has always been to be a physician, like most other physicians. I grew up in a family of physicians, uncles, cousins, whomever everybody was, and when I was sick, they used to come and visit me at night and make me feel better. And that way, I said, if I grow up, I'm going to be a doctor because I can help people. And I did, and I pursued my dream. I did my residency in Georgetown program in Washington, D.C. When I graduated, I wanted to be independent physician, like traditional doctor who can help families. And when you call, it's like a connection, create some kind of personal connection with my patients and address their problems. And I didn't want to be a businessman at that time. And I just said, I want to do whatever I want, I'm good at. And that's why after finishing, I thought maybe I could join one of the organizations, like one of the biggest managed care systems in the country. And so with the idea that I'm gonna be just doing what I love to do.
Okay.
I was with that organization for about 4 years, and after the fourth year, I realized that's not what I thought it would be.
So what did you think it was going to be? In a large healthcare organization, you would think there would be good money, stability, you don't have to be a businessman. How did it really turn out?
My thought was that, that obviously they're going to take care of whatever business aspect of the whole practice is, and I'm just going to see my patient and take care of them. But unfortunately, I realized that I just became a number. There were situations that I had no control over my own decisions.
So it's not just the patients that become only a number, it's the doctors too.
Obviously, that's what it seems like. And I left the system, and I started in a different practices, in nursing home. I visited nursing homes, did a hospital medicine, primary care, urgent care, even surgical background. I've had a surgical background doing that, and cosmetics, obviously, I did many years. And transition to independent physician practice, which for past 20 years I have practiced most of it as an independent.
And so how was that different? Was there as much business administration as you had feared there would be? Or was there more freedom?
Well, in every practice you have challenges, and you have to deal with some usually recognized issues that you have to foresee ahead of time to deal with. Being an independent physician now is very tough, and most of my colleagues, anytime we sit and have a dinner together and we talk, they always complain we don't get enough reimbursement from insurance companies. We have too much regulations that are really, we have to spend extra hours in the office to just deal with the paperwork.
Right. So you're saying that there's lower reimbursement rates and there's more time at the office and probably more staff required to be hired as well just to keep up with the administrative bureaucracy, right?
Exactly. I mean, it's not just about hiring. You have to really train your staff. That's a big, statistically it's been really shown that, is not only you need to hire more staff, you have to retain them too. The percentage of staff that are going seeking other positions, they can't stay because they are under pressure too.
Right.
They go and try to find the easier jobs or
Right.
easier positions.
Right. And so, but in doing that, that means that there's going to be a constant churn of people, and that means that you're going to have to retrain them all of the time, continue to check backgrounds, and continue to do all of these various aspects that have nothing to do with being a doctor, just to keep your doors open.
Yes, you're going to have to be more than just a doctor to be able to be an independent physician today.
Right. And the more people you bring in, the more people you have to train, the more processes, obviously, over time, you're going to have to incorporate into your practice just to make sure that you can stay in compliance with all the regulations, but also provide a quality care environment for your patient.
Yes, and that's exactly what you have to do. However, more burden you have, unfortunately, sometimes physicians have to take away time from seeing patients, quality visits, just to cope with those regulations.
Right. And so, looking at that trend of people being sucked away from their patients to run the administration, do you see that getting better or worse over time?
With the Affordable Care Act, as you know, is been there for past couple of years and still getting more and more regulations added to that, and we see everything getting just as a downhill trend.
Well, and in looking at that and some of the challenges that the Affordable Care Act represents, number one, it was written to be very vague and to allow a lot of the regulations to be actually written after the fact by Health and Human Services. So it's not even a situation where you can predict almost what it is that they're going to do to you next. Is that right?
It is really a question mark that what is going to happen in the next 5 years. There's not a lot of gray zones that we have to really sit and wait to see what happens.
Right.
Unless we take a definite action and preventive actions from our side as an independent physician, there is no way that you can change your practice overnight when it hits you.
Right, and so they're looking at things that we do know about within the Affordable Care Act, of things such as efficiency of care, which means that they may not reimburse you as much if you're seeing patients too frequently for the same challenges. You might feel as a doctor that it's the best way to diagnose a problem, but if you see them too often, you could get your paycheck docked.
Obviously, I have very simple answer. The change is, we used to call it art of medicine, but in future it's going to be art of healthcare.
Right.
Art of healthcare means that you are not pretty much just practicing medicine. You have to have skills to really deal with the healthcare legislatures, which is not what you went to school for.
Right. And in fact, even if you went to school and it's been more than a year, the landscape could have changed anyway.
It's always changing.
Right.
It's always changing.
And so in looking at that, we're seeing it getting worse, not better. More regulations coming. Are there trends that you see that might require doctors to do things like utilize technology differently or prepare their practices differently so that they can survive and optimally thrive in this ever-changing landscape?
Well, being an independent physician in the form of a traditional medicine that we really grow up with is obsolete today. Every physician has to rearrange the way they practice. We need to embrace the technology, even though most physicians are reluctant to do that, and for reasons that I don't want to go into details for. However, that's the future that we can use to our benefit, and of course, creating some kind of a network of independent physicians to help each other to stay in practice the way they want, how they want to practice, and the quality of the service and the patient care that they want to give to their patients.
So what you're saying is that there are options, because what we're seeing around the Bay Area, as an example, are more and more canvas signs going up over what used to be small practices. And now we're seeing them say things like Stanford or Palo Alto Medical Foundation or other large healthcare organizations are buying these practices out when the practices may very well prefer to be independent. What do you think is driving that?
Well, physicians, as I mentioned, majority of physicians, we are not trained to be business people, and unfortunately most physicians, they try to make the shortcut and to stay in practice. And I wouldn't blame them in some cases because they just don't have the time and the resources and the kind of a motivation to do that.
Or the knowledge. that's
And the
required.
knowledge, of course. And I would say, but that's not going to last too long. According to to a survey, and with 80% of the physicians who disagreed, they wanted to stay on independent. They said that they think that the system is going to turn around. They're hoping that there's going to be some kind of a revolution that they still adapt. And that's what I'm here to talk with you. And I want to clarify, there is a way to do that.
Okay. Even in the face of mandates, for example, in the Affordable Care Act, we know that there's going to be a push for a transition to electronic medical records versus the paper-based records that most doctors have been using and continue to use even now. What do you see as the trend in that space?
And currently, 80% of the physicians that I know in the Bay Area, they are still in paper medical record. Even though they have Affordable Care Act and Center for Medicaid and Medicare has created meaningful use of electronic medical record to incentivize the physicians to use it. However, still physicians say that I rather pay the penalties, but I don't want to turn into electronic medical record. And their reason is because they say it takes too much time on my work. I still have to sit in the front of the computer. When I see the patient, I'm just typing in. With the paper, I can just write on pen much faster. Well, I understand their situation. However, on the other hand, technology is the future. You can't ignore it. Whether it's you want to pay the penalties or you don't want to pay the penalties, that's something that you have to embrace electronic, and that's a baby steps towards reorganizing your independence.
Okay, you mentioned that those are baby steps. What are the bigger steps as people grow into teens and adults in their practices?
Well, obviously practice management is going to be a big step towards being organized, complying with the Medicare requirements, Affordable Care Act requirements. And if you would like to comply with those regulations, you're going to have to hire staff that is out of your budget. Technology will help you with the will help you keep those costs lower and be more efficient. And on the top of that, you can provide better service to your patients.
And that really is the goal of most doctors.
Their goal is, they understand that, but they cannot afford it. And but there are solutions for that.